British Columbia says it plans to restrict how much of the diabetes drug Ozempic can be sold to customers in the United States. Demand for the drug has been surging as celebrities and doctors tout its weight loss benefits. BC's health minister says 15% of recent Ozempic prescriptions in his province came from Americans, many of whom are getting those prescriptions from another province.
95% of all the prescriptions for Ozempic issued to U.S. residents were by one or more prescribers who identify themselves as a practitioner in the province of Nova Scotia. This is concerning, and in my view, it has to stop. The purpose of procuring the Ozempic for British Columbia patients is not to turn around and export it right back to the United States. The purpose of procuring Ozempic is to make sure patients in British Columbia and Canada can continue to access it.
The CBC's Sarah Galashan is tracking the story from the Vancouver newsroom. So Sarah, let's just kind of dive down into what Adrian Dix had to say. The prescriptions coming from Nova Scotia are filled in British Columbia, where you are, for American patients?
That's right. Basically, that is the route that this is taking. The Health Minister Adrian Dix saying that he is looking to Nova Scotia to figure out why it is physicians in that province would have anything to do with this in the first place. And while he's not naming the just two pharmacies in BC where 88% of these prescriptions coming from Nova Scotia are actually being filled for Americans, he will say that both of those two pharmacies are in the Metro Vancouver area, and he is interested in any review that might be done on the practices of those two particular pharmacies. He is not, though, waiting for any answers to come from any such review. Instead, he's saying that he is moving forward with plans to restrict the sales of this drug to people outside of Canada. That restriction would, of course, apply specifically to Ozempic because 15% of sales in British Columbia are being made to Americans, at least for the months of January and February. And by comparison, if you look at other drugs that are being sold in this province and to Americans outside of the province, they account for less than a full percent, about 0.5%. So it's quite a disparity here. That, of course, begs the question, why is there this drive in demand for this type 2 diabetes drug, Ozempic? And Adrian Dix, as you mentioned right off the top there, he is blaming this on basically celebrities, social media influencers who are touting this drug as an effective way to lose weight. Andrew?
So, but is that even safe? If someone doesn't have type 2 diabetes, should they be taking Ozempic? Should they be taking this drug?
I mean, bottom line is that it is not approved for that use in Canada. It is an injectable medicine that helps to improve blood sugar levels. That's why it is effective and used commonly in treating type 2 diabetes. In fact, BC has actually recently moved to make it more available to patients with type 2 diabetes under the PharmaCare plan in the province. So all the more reason they want to ensure that there is enough supply in this province for those type 2 diabetes patients. As far as risks to those who are wanting to take it just to lose some weight, this is what a doctor who specializes in the treatment of type 2 diabetes and obesity had to say on that.
Firstly, we do not know what the effect would be in individuals that do not have obesity or overweight. And also, it's important to note that obesity is a chronic condition, so it's a long-term medication. If individuals are only using it for a short term, for short gains, there is a potential risk of weight rebound that can happen in these individuals.
Certainly there is a lot of anecdotal evidence to suggest that you will drop some weight if you are taking Ozempic, but as he's saying, the people who it is tested primarily on people who are taking it because they need to and really for the long term. So there are questions basically about the safety long term for those who don't have an issue like type 2 diabetes. Andrew?
Sarah, thank you. The CBC's Sarah Galashan live in Vancouver.